Dr. Molly Force, and I am the clinical director here at Prosper. I'm joined today by Dr. Rosalie, and Dr. Mary will be joining us in just a minute. She's finishing up with a patient right now. And we have this, I think, pretty wonderful practice here in Port Townsend, Washington, that really allows us to practice naturopathic medicine, which is essentially primary care medicine with a natural focus. And what we love about this practice is we do something called team care. And so that means that all three of us doctors work with our patients together to really promote wellness from a very holistic standpoint. And one of the beauties is that Dr. Rosalie has an Ayurvedic background, so East Indian and East herbs, that she shares with the practice. And Dr. Mary has a Chinese medicine background and can do acupuncture as well as Chinese medicine with her patients. So it's pretty special to be able to bring that East and West and provide that natural, holistic care model to patients. So today we're really excited because we've started doing these clinical spotlights, and prior, we had been doing doc talks, which have been really fun, just a way for us to share information with our community and with folks who are interested in learning about natural medicine. And we want you to all know that on our website at prospernaturalhealth.com, we have all of these past talks archived. So if you get some good information today and are looking for more information or about a specific topic, we have a lot of these archived online. But what we've started focusing on is really relevant clinical questions that we get. And today is all about vitamin D. Now, vitamin D, we're going to find, is a big deal because it's actually not even a vitamin. Turns out it's actually considered a hormone in the body. So today we want to make sure you guys have a really good understanding of vitamin D, which form is best, what the heck it is even doing for your body, how you can best absorb it, are you getting enough, do you have too much, and how do we get those levels checked? How do we even know? So we're going to go through all of that with you today. And once again, we want you guys to walk away with some really tangible information. We're going to start with some science. So brace yourself, hold in, hold on for this, but we're going to, we want you guys to have a really good background on this and understanding of why this is such a critical nutrient. And once again, there are a lot of differing opinions in the medical world about vitamin D. So what we did is we went through all the latest and greatest research about vitamin D, a lot of meta-analyses, and we want to present some of that data to you today. So Dr. Mary's here.
All right, thank you, Dr. Molly. Great, thank you, Dr. Molly. So next, we're going to go into some of the basics of vitamin D, and I'm going to start with how do we get it into our bodies? What are the sources of vitamin D that are available to us? So one of the first things that we're all aware of is the skin absorption piece. We know that vitamin D comes from UV exposure, so exposure to sun rays. And so this is interesting. So we create this substance, 7-dehydroxycholesterol, in our skin, and then can naturally create vitamin D via the exposure to the sun rays. So there's limitations to this type of production. We'll get into this a bit more later, but in our latitudes, it's actually really difficult to get this level, to get adequate levels of vitamin D from sun exposure. But, and the other thing is so in the summertime, it is possible here, but there's kind of a plateau at 30 minutes of exposure, of sun exposure, after which we stop creating more vitamin D from from those sun rays. So it's just important to keep in mind, the sun in moderation, and the exposure of as much skin as possible to the sunshine in the summertime is a viable source of a small amount of vitamin D. Next, we've got dietary intake. So Interestingly, there's very few naturally occurring sources of vitamin D. It's convenient that in northern latitudes, many cultures, such as here and in northern Europe, tend to eat a lot of fatty fish, because that is one of the sources of where vitamin D is highest. And then in the United States, we often see vitamin D fortified in certain foods like milk, orange juice, and cereals. But because, skin absorption and dietary intake can be really challenging in our modern world, where we're not out in the sun as much as we maybe were in, human history, we often are relying on supplements to get enough vitamin D in our system. And so these supplements can come in a couple different forms. We've got vitamin D2, also known as ergocalciferol, and this is synthesized in plants, mushrooms, and yeasts. And this is a vegan form, which is helpful to know if you avoid animal products. And then we also have vitamin D3, also known as cholecalciferol, and this usually comes from an animal source. And it tends to be more effective in improving vitamin D status. And that's because there's less steps that it has to go through in the synthesis process. So it's kind of more ready to be active and be converted into active calcitriol. Okay, so next we're going to talk about how it's synthesized in the body. And we touched on this a little bit in the last slide, but we're getting into the nitty-gritty of this. Again, we create that pre-vitamin D, and that can be synthesized via the UV exposure from sun. And then we also have the dietary intake. You can find the cholecalciferol and ergocalciferol in these in this synthesis diagram over to the right. And one thing to note that's pretty interesting is that it requires our liver and kidneys to convert vitamin D. So with compromised liver and kidney function, that's one of the things that will signal us to check the vitamin D levels and make sure that we're having adequate responses to vitamin D that we're consuming and synthesizing. You can go to the next slide. Okay, so more about forms of vitamin D. So one thing that's really fascinating is it's not a true vitamin. So this means that it's acting on our cells like a hormone, kind of similar to estrogen or thyroid hormone. It's acting on our tissues to enable a response versus kind of assisting in an enzymatic reaction or assisting in another process in our body. So, and that's important to remember with taking the calcitriol, vitamin D3 or the active vitamin D. It's something that we, just want to be aware that it does have more direct physiological effects. And so so the two major forms that you find in supplements are going to be calcidiol or vitamin D2. And this is the one that we test because it's the one that's widely circulating in our body and is kind of waiting around to be activated into calcitriol, which will, that's the active form that will actually exert an effect on our bone and other tissues that we'll discuss in a moment here. All right, so next I'm going to pass it off to Dr. Rosalie.
Thanks, Dr. Mary. So the basics about vitamin D, this is a really important slide because it tells us just the breadth of action that vitamin D has on the body. Ultimately, there are vitamin D receptors on nearly every cell type of the body, which is also why it ends up being in this pro-hormone category, is that it just has far-reaching effects. So you can imagine that a deficiency would have far-reaching systemic repercussions as well. So the biggest things we want to highlight here is the functions of vitamin D. And those first two, calcium and phosphorus balance, they're just inextricably connected with vitamin D intake. So they sort of help each other out in terms of being absorbed, which you can imagine that's very helpful for bone building. So if you have a supplemental regimen where you're adding calcium because there's some osteoporosis, there needs to be more of the nutrients there, including vitamin D, to truly help build bone. The other thing that vitamin D can do is what's known as cell differentiation. And this is specific to the intestinal tract in helping what are known as the enterocytes, which are the cells that line sort of the mucus lining of the intestinal tract. It helps them turn over, right? And what's really helpful in this turnover is to make sure that the gastrointestinal tract stays nice and healthy. And vitamin D helps support that. It's also an immune system modulator, which means that it enhances immunity in terms of helps our body pump out the immune cells that are needed. And it also contributes to inhibiting the development of autoimmunity. So it's really important. You've probably heard about vitamin D being helpful for boosting the immune system. There's so much more to it, ultimately. It's a modulator. It also helps with blood pressure regulation, which is something I always forget about clinically, but there's really good data here in terms of supporting what's known as the renin angiotensin aldosterone system, which is just sort of a fancy biochemical term that tells us about how blood pressure is increased in the body. Anyways, vitamin D has an action there. Additionally, it's a mood regulator. There's a lot of studies that show how low vitamin D is linked with low mood. And we'll talk about some of those studies later. And then lastly, it being a prohormone, it means that it's made of the same building blocks as the sex hormones, etc. So it can be helpful in supporting low hormone states as well. So when you have deficiency of vitamin D, in severe cases, especially with children who for many years don't have enough vitamin D, we see something known as osteomalacia or rickets, which is something we since we've fortified our foods with vitamin D, like orange juice, etc., and milk, we don't commonly see rickets anymore. But prior to that fortification of food, it was something that was was present, and it meant that there was a softening of bones, especially those growing bones in kids, and so the legs would bow out and chronically be you'd sort of chronically be bow-legged. Like I said, we don't see too much of that anymore. We see a lot of subclinical deficiency, however, that contributes to osteoporosis, so decreased bone density, also closely contributing to cardiovascular disease and atherosclerosis. This has to do with calcium deposits. And remember, we talked about vitamin D being important for calcium absorption. This also all plays into it as well in terms of the blood vessels. Again, subclinical deficiency, even a small minor deficiency, can lead to big mood changes, instability, and most notably depression and low mood. It also can be linked to increased inflammatory response, and specifically I've seen it linked with autoimmunity. And then also it downregulates, a deficiency will downregulate the immune system. So you're not as good as fighting off viruses. And so the flip side of this is what happens when you get too much vitamin D. And clinically, I see this rarely because we do a lot of blood testing. We'll talk about this later. But I do see it show up on occasion with my patients who dose vitamin D really high for a long period of time. Since it's a fat soluble vitamin, it means that it's not excreted quickly by the kidneys and urinated out, which means it hangs out in the fat stores in the adipose cells, in the fat tissues, etc., meaning that you can overdose on vitamin D if you have too much for too long. Severe hypervitaminosis D is sort of the diagnosis here. It ends up being vitamin D toxicity. Symptoms of it would be excess calcium, right? So that means all sorts of things, from affecting our electrolytes to our brain, to our heart. So you can see here neurological symptoms, gastrointestinal symptoms, heart system symptoms, including arrhythmias. You would also get kidney symptoms, where the body's trying to help remove that toxicity, but isn't quite able to. So symptoms of excess urination, severe thirst, kidney stones even, can also lead to renal failure. Ultimately, like I said, I don't see this too commonly, but it is worth noting, especially if you haven't had your vitamin D levels checked and you are supplementing.
So here's a question we get quite a bit in our practice. Do people need to be supplementing with vitamin D? And that really is answered from a few different questions, but one of the biggest factors is where you live and if you are getting enough sun exposure. So at our latitude here in Port Townsend, we're northern enough that we really cannot get sufficient vitamin D levels from sun exposure alone, typically. So that is something that, we really want to think about. And if you look at maps of D deficiency, you can see there's these bands in the northern and the southern zones of the different hemispheres, where these different latitudes are just not getting the UV light that's required for the vitamin D synthesis. And so supplementation is generally required at that point. And we know that during these colder months that are darker, so that December through February, latitude strongly determines how much UV light there is and how much vitamin D is absorbed during that time. So it does change depending on where you are living, as well as what time of year it is. So as far as that sun exposure. With vitamin D testing, this is probably the number one most important piece for you guys to understand. It is something that is so individual that we cannot know as clinicians exactly what your D levels are without blood work. So this is something that's done with a serum blood draw. It's a standard non-fasting blood draw, very simple to do, and it will let us know exactly what those vitamin D levels are as far as what that circulating amount of vitamin D is. Now, we know that there are different ranges, that the labs generally have this range from 0 to 100 that we're looking at, 100 being high. We know that depending on where you're living, you're going to have a much lower amount of vitamin D typically, unless you're supplementing. And we know that when we have low amounts of fatty fish, for example, in our diet, that's going to put people at more risk of having lower amounts. When we're looking at our lab results, this is a good example of one. We see here that this patient has a 28, which is considered low. Anything below 30 is clinically seen as a significantly low. And that means that we're usually going to be having some symptoms of that, although it can be labeled as subclinical, and that you won't have what's considered a severe vitamin D deficiency unless you get under 10 typically. The important piece here, though, is that these levels will change with supplementation. So typically, once we start getting people on a vitamin D level, we want to see their tests repeated within 6 months. So usually 6 months, because the liver is storing our vitamin D that we're supplementing with, and we want to make sure that we're not getting too much of this fat-soluble vitamin. We typically are asking our patients to repeat vitamin D testing annually. And this is really important to get a good understanding of what your vitamin D levels are. There are genetic variations that affect how well you absorb vitamin D, and this makes it a very individualized process for us. So we love having this be part of our annual blood work that we get, and we want to really make sure that we're getting into those optimal levels. Now, that's a big question. What is an optimal level? So we just pulled all this research, and there's quite a bit of variation within the medical literature about what is considered to be an optimal level. What we see as a consensus from the medical literature that's been released up till now is that if you're below 30 for your vitamin D levels on this 25 hydroxy vitamin D testing, then you are deficient and you need to supplement. We need to get those levels up. Most of the research shows that if we can have your levels above 50 and below 150, then you're in a good range. Now, for us, when we go for our clinic, when we see those ranges go above 100, we're usually starting to make sure we're backing off on that supplementation. But generally, above 50 to 100 is kind of a goal. And depending on what's going on with the person, depending on their needs, if they have bone thinning, osteoporosis or osteopenia, or if they have autoimmunity, immune dysregulation issues, they might need to have their optimal level be a little bit higher than their neighbors, for example. So once again, this becomes individualized depending on a person's medical needs and a person's sun exposure, where they're living, and then what their levels are when we're testing them. So once again, get those vitamin D levels tested. It's just such important information. So why? What does it do for me? We've already talked about what vitamin D can do in the body. Now we're going to start getting into the research. So like I said, we just did a massive literature review. These are some of the biggies that really come up as correlations when you're taking supplementation to help prevent these health issues. So we see good clinical evidence that it's helpful for prevention of anxiety and depression. We see it with different cancers. We see it with cardiovascular disease. Remember, that's still our #1 killer for Americans. So really important. We see it for diabetes, risk reduction. We see it for reducing risk of multiple sclerosis. Same thing with any kind of neural brain inflammation or inflammatory issues, so brain dysfunctions. We see it with immune dysregulation, and so that's where we get into that autoimmunity. We also see that vitamin D has been demonstrated to be antimicrobial in action, as well as considered to be an anti-inflammatory. So those are very powerful uses of vitamin D for us. And then overall, the studies show that supplementing with vitamin D, now this is, at a proper level, of course, for that individual, but supplementing with vitamin D at even lower amounts, 1,000 to 2,000 IUs is what this study was looking at, reduces our overall mortality risk. So that's pretty phenomenal that this nutrient can help us with that. So Dr. Mary is going to launch into some really cool research for you.
All right. Thank you, Dr. Molly. So next, we're going to dive into some recent studies that have been conducted with vitamin D supplementation. And so one of the cool things that I came across in doing this, research for this talk is that, for a long time, a lot of our assumptions and use of vitamin D was based on correlation. So seeing lower levels of vitamin D in the blood being associated with various conditions like osteoporosis, like depression, a number of things that Dr. Molly just mentioned. But recently they've started doing what we call randomized controlled clinical trials where, there's an intervention and the patients are tracked over time, the subjects are tracked over time, taking vitamin D over a number of years and then tracking their disease outcomes. So this is a very different way of doing research that, is generally considered more robust. And from 2012 to 2018, there was a study called the VITAL study that looked at vitamin D and omega-3 fatty acid supplementation and the study period, was about 8 years. And they looked at the subjects included over 30,000 participants, so a pretty large trial. And it was mainly focused on men over 50 years old and women over 55 years old, so older individuals. And so we're going to get into next. I'm going to discuss the most pertinent or, the most striking findings that they found in terms of the disease outcomes with vitamin D supplementation. And interestingly, the major hitters or, winners of that trial were autoimmune diseases and cancer, prevention of advanced metastatic cancer. So we'll go into that next. So first, let's talk about autoimmunity. So this was a trial where they were doing a secondary analysis of vitamin D specifically and omega-3 fatty acids, but they broke up those interventions on the incidence of autoimmune disease. And what they found was that vitamin C for 5 years, with or without omega-3 fatty acids, so vitamin D alone, reduced autoimmune disease by 22%. That's pretty significant, when we're talking about these diseases that can severely impact people's lives. So this was a pretty big finding to me. And then interestingly, the omega-3 fatty acid supplementation, meaning fish oils and other forms of omega-3s, with or without vitamin D supplementation, decreased the disease rate by 15%. So that was not statistically significant, but the vitamin D, the effect of vitamin D was. They also found that together they decreased the disease incidence of autoimmune conditions by 30%. So that's an even bigger finding. And, if you are working with us, you're often, particularly with autoimmune conditions, you'll often find that we're having people on both vitamin D and omega-3 fatty acids. This is one of the, reasons why we're doing that. And another interesting thing to note is that they found the greatest benefit with specifically rheumatoid arthritis and psoriasis as the for autoimmune conditions. So super fascinating. So, I love to look at mechanisms. My brain always likes to kind of pick apart why we're finding this clinically and in clinical trials. And so just if you're curious, I'm going to explain that. So we talked about vitamin D as an immune modulator. So that's a fancy term meaning it's both stimulating and decreasing immune responses in different ways. Like Dr. Rosalie was saying, it can, enhance our ability to prevent COVID infection and other viruses, right? But it also is down-regulating our immune system when it comes to the, autoimmune reaction to our own tissues. So, and this, in animal studies, they found that this happens via gene expression. So it affects gene expression that's related to the inflammatory response. They also found that there's a lot of vitamin D receptors. So, little keyholes for the vitamin D puzzle piece to fit into on immune cells, specifically T and B lymphocytes, that have a lot to do with autoimmune processes. And then they also suppress certain cytokines involved in the development of autoimmune disease, that, these messengers that stimulate an inflammatory response. And then lastly, they found increased production of T regulatory cells. So this is one very fascinating immune cell that actually down-regulates the immune system. A lot of immune cells are kind of amplifying immune processes, but this is one that puts the stop on the inflammatory response. So these are all really interesting pieces as to why it's helpful for autoimmune conditions. All right, so the other major category of benefit that they identified in this particular vital study is the effect on the development of advanced cancer. So this means, going from an earlier stage cancer to metastatic or spread or fatal cancers. And they found a 17% reduction in advanced metastatic or fatal cancers, which is really amazing to me that they found this with, just 2,000 IU of vitamin D per day. And they also found the strongest reduction in individuals with a normal weight and no benefit in individuals that are overweight or obese, which makes me wonder if there's a dose issue that, perhaps increased levels of vitamin D would be helpful in those individuals, but that is not something they went into in the study. And again, looking at the mechanisms here, other studies in the past have shown that vitamin D can help inhibit cancer cell growth and proliferation and act to reduce the cytokine response, which can stimulate tumor growth. And also help with the term pro-apoptotic means helping promote cell death in cells that the immune system identifies as cancerous. And then it also may decrease tumor invasiveness. So the ability of tumors to spread in the body. And there's also just in general higher vitamin D levels at the time of diagnosis have been linked to longer survival in cancer patients. So all really fascinating and I think really important clinical information for us. All right, so next I'm going to pass it on to Dr. Rosalie to talk about mood.
Thanks, Dr. Mary. Yeah, that vital study is really fascinating in terms of all of the things that they found over that many patients and that many years. So, these doc talks are so fun for us because we get to really nerd out about this stuff. But here's some research about vitamin D and mood. which specifically touching on anxiety and depression. And what's fascinating here is that this study from 2022 showed that there's a very high statistically significant frequency of vitamin D deficiency in subjects who have depression. And what the study also noted is it didn't have to do with how deficient they were. Were they very deficient or just a little bit deficient? Just a general deficiency, even of just a little bit, was seen to correlate very closely with mood disorders. A lot of that has to do with the fact that vitamin D can pass through the blood-brain barrier, which means that it has an action on the brain directly, and specifically on the levels of, on the areas of the brain that are linked with anxiety and depression. So things like the cortex cerebellum and limbic system. So if you know any brain science, the limbic system is your sort of emotional epicenter. And so vitamin D can bind there since it crosses the blood-brain barrier. They noted as well that it was also seen to help with anxiety. I think the biggest data is on depression, but we're starting to see more data on vitamin D in its helpfulness with anxiety. Here's another research study that was done in 2016 on osteoporosis specifically, and it involved supplementation of vitamin D and calcium together. And it noted that there was a 30% reduction in hip fractures in patients who had both supplements on board. Also a 15% reduction in overall fracture risk. And this was in older individuals. I think the age range was above 50, where they looked at 30,000 total patients and over 2,000 total fractures, right? So a big study that had these statistically significant findings. The calcium dosages that were used were from 500 to 1,200 milligrams per day. Vitamin D dosages alongside that were from 400 to 800 IU, which nowadays we're reporting vitamin D in micrograms instead of IUs. So that's, yeah, we'll talk about that a little bit later. But in 2016, those were sort of the dosages that led to these findings.
Okay, we're going to talk about immune system regulation, specifically with COVID, because it's still considered pretty relevant. There's now a ton of data coming in about COVID-19. We know that the severity of COVID-19 for people does seem to be matched with vitamin D levels. And so they do show that if you go into a COVID infection with significantly low vitamin D, then you're at higher risk of a poor outcome. So one of the most significant things that a lot of these research studies are really presenting at this point is this idea that going into an infection, you want to have an adequate amount of vitamin D because it allows the body to respond appropriately to that infection. Now we finally have all this information that's coming out more about specifically about long COVID and those kind of things. I'm going to talk about that in just a second. One of the important things to understand with vitamin D is that it's modulating as a hormonal piece against these upper respiratory tract infections. So it's not just vitamin D that they have these studies on. They've also done studies against Epstein-Barr virus and cytomegalovirus, and even Hep B and Hep C with vitamin D. And they found that they the vitamin D can help reduce some of the inflammation that's caused by these viral actors. Now, with things like long COVID, finally this information is really getting into our hands as clinicians because these research studies are being released. There was one from 2022 that really tried to look at, is there a big relationship with vitamin D and if people develop long COVID or what's called long haulers. And what we actually see is that we don't necessarily believe at this point that if you go into an infection with, or if you're in the middle of the infection, the COVID-19 infection with vitamin D, it doesn't necessarily correlate with whether or not you're going to end up with something like long haulers, but we do know that it does affect that acuteness of the infection at the time of infection, if that makes sense. So they believe that this has to do with vitamin D being downregulated actually by some of these viruses. It's just an interesting theory they're looking at, but we're really excited because there's a new study that's being released pretty soon here, we hope, and it's short for, they're calling it VIVID, which is like the beginning of vitamin, and COVID, end of COVID, VIVID. And this is an ongoing clinical trial right now, but we're looking at adults, so 18 years old plus, and what the effects for them are of supplementing daily with vitamin D. And these are people who have been diagnosed with long COVID. So we're trying to see what happens after we have these chronic viral, what we call sequelae, or things happening after these chronic infections, and how the immune system is regulated by vitamin D with that. So that's a watch and wait sort of scenario for us. So we all have lots of questions about dosing, I'm sure, out there. So the question really becomes, once again, very individualized, like we were talking about with that importance of that testing piece. We want to know what your test results are. So take some time this week and go through your medical records and see when the last time that you had your 25 dehydroxy levels done for your vitamin D levels. And you want to make sure that those are done annually, in my opinion. So we want to look at those results and we want to know if we're in our optimal zone, if we want to keep up the same supplementation that you've been doing, or if we need to initiate supplementation or reduce it. And once again, gene expression makes a big difference here. So they say if your levels are not optimal, according to the research right now, we are supposed to be retesting every 6 months as clinicians. So that's what the recommendation is. So if you get your results back and they aren't what you want them to be, please do push for that retest in 6 months. Put a little reminder on your calendar or phone. Now, sun exposure, we know that 10 to 20 minutes of sun exposure a day, especially in the summertime, can be really helpful for your vitamin D levels. That has to be weighed with our risk of skin cancer. So if we tend to more skin cancer, that might be something we're a little bit more careful about. And we of course, want to be covering after we've had our 20 minutes of exposure to be protecting our skin. We also know that folks with darker skin tones require more vitamin D, and that has to do with the melanocytes and how the vitamin D is regulated by the UV light being blocked by that darker skin tone. And so that reduces the amount of vitamin D that's able to be absorbed. So that's something to take into consideration as well. When we're thinking about supplement dosing, it's good to know that the recommended daily allowance by our FDA, the RDA that has been set forth, is for people over 19 years old, but below 70 years old, it's 600 IUs, which we would consider fairly low for supplementation, 800 IUs for a 70-year-old and over. So in general, what we're seeing when we're at these higher or lower latitudes are that most of our patients are generally needing between 4,000 to 6,000 in the winter, 2,000 to 3,000 IUs in the summer. But remember, there are times that we're giving higher amounts, even 10,000 a day for a few months to get these levels up if it's necessary for their clinical conditions. So it is individually recommended depending on what those blood levels are showing. We want to be really careful of our conversions. This is newer for us as clinicians, the switch from reporting IUs, these international units, to micrograms for vitamin D. So be careful when you're buying an over-the-counter supplement that you're really getting an understanding of how much you're taking, because it is very dangerous to overdose on that vitamin D. Remember, it's stored in those tissues, especially in the liver, and it can really affect how your kidneys are functioning. So we really want to make sure we're not overdosing. That's why we do that 6-month follow-up for the testing. We want to take our vitamin D with meals. Now, why is that? We want to take it with meals because remember, it's a fat-soluble vitamin. So if we have a meal that has fat in it, it's going to help bring in that vitamin D, which is just so important whenever we're taking it. We've got several different sources of vitamin D that we have available to us. I'm going to pass this over to Dr. Mary to share this with you.
All right. So here we've got a couple of sources of vitamin D that we carry at the clinic. And the ones that I probably use the most often are the liquid forms. And I just really like the fact that they're very versatile. So, often I'll have patients on bone supportive supplements, and that often has some amount of vitamin D in it already. And so I really like to be able to adjust the dose that we want to add to it. So the liquid D3 and the vitamin DK2 are really great for that purpose. And so it's important to note that these two supplements are coming in a dose of a drop dosing. So, and we talked about the signs and symptoms of overdose and how it actually can get really serious. So you want to, if you're taking these liquid forms, be really careful to do the drops, not the full dropperfuls, because that can lead to vitamin D toxicity pretty quickly. The other ones that are really great is the vitamin D 5000 IU. This is great for folks who need a higher dose of the of vitamin D and don't want to take many drops a day, and also just prefer pills. That can be a personal preference. And then we also have the liposomal D Supreme. This one's great in its delivery form. So liposomal means that it's packaged in little fat pockets and is more easily absorbed at our either through our lymphatic system under our tongue or through our gut by, it helps with the absorption at that gut intestinal lining. So that's another really great form that is potentially even more absorbable than these other forms. We carry them all at the dispensary and they're available for walk-in purchase.
Another form that's out there is an injectable form, surprisingly enough, and it's something that I've seen clinically work really well for my patients who have malabsorption of sorts, celiac, Crohn's disease, etc., who just aren't able to get an oral amount that's sufficient enough, and we'll do intramuscular injections for those folks, and I've seen it raise vitamin D, blood vitamin D levels, as well as the oral forms, and sort of keeps the levels sustained over time a little bit better. I've also used injectables with my patients who are higher BMI. Since I think, and again, this is just my hypothesis on it, but I've seen it clinically work. I think since vitamin D is a fat soluble molecule in folks with more adipose tissue, I think the body just stores and holds on to the vitamin D a little bit better instead of moving it about the body. And so the injectable form of vitamin D I've seen help a lot with my high BMI patients who need more vitamin D, who are deficient.
The other piece here is the vitamin K addition, and you'll see that in this Thorn liquid and also in this Designs for Health liposomal D Supreme. And we kind of mentioned that K can help as another fat soluble vitamin with that D absorbing. So if you're somebody who's been doing your lab work and not seeing those levels increase, you might want to be thinking about making sure that K is with your vitamin D3. And that's not always the case for every patient that they need that K2 addition, but for some it can make a big difference. Is there anything else you guys wanted to share about these different Ds? The one last thing I'll say is it's nice sometimes to have the liquids also because you don't have to pay for the encapsulation process. So it can be a little bit less expensive. So that's nice to have those higher concentrations and not have to pay as much for them.
So that concludes our doc talk on vitamin D. And feel free if you have any questions that have come up during this presentation, feel free to add them to the chat box and we'll have time for a Q&A here. But while you're thinking, I want to talk through what we will be talking about next month for the Doc Talk Clinical Spotlight. And we've decided to do it on B12 because we've had a lot of questions about, you know, sort of similar to vitamin D, how much do I need? Do I have a deficiency? What does it lead to? What are B12 injections, right? That's another therapy we offer here at the clinic. So stay tuned next month, April 11th, for a clinical spotlight on vitamin B12 and research. We'll dive into the research and present that for you.
So if you have any questions, go ahead and put it in the chat box. We want to invite all of you, if you have questions about what your vitamin D levels are or are having a hard time getting those ordered through another provider, we're happy to help you look at those levels or help you interpret those levels with your own healthcare needs, because once again, it does have a major impact on your body, those vitamin D levels, and we sure do want those to be optimal for you to help you with your health.